Hello dear patients. Today we are going to review the case of red scar on glans penis after circumcision. A young man came to see us and for a long time he had some changes on glans penis. Urologists advised him after setting the diagnosis of balanoposthitis to do circumcision. It was done, however this rash reddened even more. On the picture you see that on glans penis there is a round-shaped scar of a clearly defined form. This scar has inflammatory element in its color, that is roughly speaking reddening. According to the patient, it increased after circumcision operation. What do we see here? Here we see a scar that appeared not after trauma, according to the patient, but it appeared quite a long time ago, and it is lichen sclerosus. What is a lichen sclerosus? You can see a separate video on our channel. In short, this is a scary change of glans penis skin, which may lead to oncological disease, that is, they are precancerous, that are apparently autoimmune when the immunity attacks the body. In this case, they require examination for infection factor borellio bordoffeli and for allergies, as during allergies there may be an inflammation of sclerotic scar. That is, a blood test has to be taken as well as for connective tissue disease, which is mandatory during different changes including lichen sclerosus, which was done for this patient. Slight increases of immunoglobulin E were found and the patient was consulted by allergologist as well. What needs to be done in this case? In this case it's good that circumcision was done because it minimizes the risk of oncology development. In circumcised men, oncology of glans penis is almost not seen at all. Secondly, considering the sclerotropic component of lichen sclerosus, the following may be recommended: A. Electrophoresis with lidasa with dexamethasone. B. On initial stage, vascular injection preparations by type of nicotinic acid, ozone intravenously, calcium gluconate intramuscularly, considering the presence of increased immunoglobulin E, sodium sulfate intravenously. Externally, glucocorticosteroid creams and ointments can also be used. In this case, such complex was used together with vitamin therapy, B6, B12 vitamins every other day. As a result of that, such acute inflammatory reaction eased. The scar from lichen sclerosus got this light shade and it is slightly decreased in size. Later on, in addition to this therapy, anti-malarial drugs were prescribed and photodynamic therapy was done. I'll remind you that photodynamic therapy is a treatment of such scar by laser. Basically speaking, very roughly, we polish this scar and remove it very superficially, and we induce anti-inflammatory effect in it. Shortly speaking, this is so. This is indicated when scars during lichen sclerosus raise above the skin surface and are not sunken and atrophic. Therefore, such complex therapy is not going to heal this patient from lichen sclerosus. However, it can significantly decrease the extent of lesion and it can minimize the risk of turning into oncology, and further on follow-up of such patient is required. If it is necessary to diagnose and treat different lesions and diseases of genital organs skin, you can consult venerologists and urologists of our paid medical center of dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such diseases. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram, and thank you for your attention.